WTTY prior to the meeting. Public can view the meeting on the YouTube of the Board of Alders or online at the provided URL on the public notice, and by phone at 888-475-4499 and enter the webinar ID 921-250-37915 and passcode 543-56445. If you wish to present testimony at the meeting, please register in advance at the URL provided on the public notice or call 203-946-7934 before 2 p.m. on the day of the meeting. Public comment and testimony may also be submitted via email to publictestimony@newhavenct.gov before 2 p.m. on the day of our meeting. Now I'd like to introduce the members of this committee, starting with my vice chair.
Thank you, Mr. Chair. Alder Ron Hurt, Ward 3.
Alder from Ward 1.
Alder Eli Sabin, representing Ward 1.
Alder from Ward 8.
Good evening, I'm Ellen Kupo. I represent Ward 8 on the Board of Alders.
Alder from Ward 21.
Stephen Winter, Ward 21.
My God, I memorized all the numbers. That was great. And a miracle. Okay, so we will begin by inviting the makers of the resolutions. You may begin the testimony by stating your name and address for the record.
Good evening. I do have to apologize. I just got home and my dog working. I'm sorry. Marixa Bond, Director of Health. My residence is 784 Quinnipiac Avenue, New Haven, Connecticut. I am here to speak on the ELC grant. I'm sorry. The ELC grant, which is a 2.5-year grant from the Department of Public Health in the amount of $1.2 million to enhance the capacity to detect, respond, and do surveillance to prevent COVID-19 in my city residents. So sorry. I am so sorry. He thinks he's protecting me. All right. Sorry. The funds will be used to hire 3 full-time and 2 part-time individuals. They will consist of 2 contact tracers, a half-time compliance tracker, APRN, an epidemiologist, and a nurse coordinator. Additional funds will be used to provide equipment for the new hires, which consists of laptops and cell phones, as well as proper PPE for to perform their work, office supplies, staff training, and the statistical software for the epidemiologists. The deliverables that we aim to achieve within this grant is to enhance laboratory detection, surveillance, contact tracing, response, informatics, and other workforce capacity. What we're going to aim to do is to build our capacity internally so that we can be able to prevent and be able to address any potential outbreaks in the city. The nurse coordinator specifically will be working with the emergency preparedness regional section. So for the emergency preparedness coordinator in the region to do mass vaccination. As you know, we're preparing for an upcoming vaccine. So the nurse coordinator will be participating in the emergency preparedness planning. We will utilize the epidemiologist and public health nurse that will be hired under the funding for critical workforce and mass vaccination and flu vaccine efforts. The epidemiologist will also work on updating our infectious disease plans, as well as tracking and being able to assist with the surveillance in the system. The epidemiologists will work closely with the contact tracers and staff. They will all be trained under the contact CT system, which is our contact tracing system, and activities to increase timely data management, analysis, and reporting for COVID-19 and other conditions for public health significance. We also aim to strengthen laboratory testing volume and capacity. So the nurse coordinator will continue to work and support the COVID-19 testing sites in different hotspot areas that we have throughout the city. We will partner with local coordination of testing with local testing sites, community health centers, and others alike to ensure that there is expansion of testing within communities that need testing. We will also, third, coordinate and engage with partners. The coordinator and epidemiologist will work closely to build essential partnerships with federally qualified health centers, faith-based organizations, community-based partners, universities, and other congregate healthcare settings within the jurisdiction to ensure testing for community members and minimize the spread of COVID-19. Our aim is also to have the nurse coordinator assist with the regional essential function 8, which is regional planning with other healthcare professionals to share resources as needed with the region and statewide support with statewide efforts that support and benefit the local city. We will also have contact trackers that will engage with the regional community resource coordinators to support individuals with self-quarantines or isolation as needed. Another measurable outcome is to prevent and minimize transmission of COVID-19. The coordinator and the epidemiologist, as well as the compliance tracker, will provide guidance and training for local business sectors, summer camps, and summer schools to ensure entities are operating in accordance with the COVID-19 guidance, reopening for the phases that are initiated by state and local governments. Our last deliverable will be to conduct health promotion activities associated with all of the above. All staff will continue to create and promote culturally and linguistic appropriate health education materials to help mitigate the spread of COVID-19. Thank you. Back to the chair.
Thank you. We'll begin with rounds of questions, and I'm going to ask my standard question surrounding the grant time period. We noticed that the grant period started in May 2020, but the submission wasn't until September 2020. We just wanted to get some clarity on that.
Yep, and so the Department of Public Health applied for a grant. We did not apply and pursue this grant. They just were notified by the Center for Disease Control. We received our notice and immediately submitted our paperwork. We've been given to September 30th to submit a work plan, and then on anticipation for execution for October 30th. And so the timeline will change when the contract is finalized.
Thank you. Now we'll turn to questions from members of the committee. Mr. Vice Chair.
Thank you, Mr. Chair. I have no questions at this time.
Alder Kupo.
Thank you, Mr. Chair. Just one question. So with the change in timeline, will that affect the change the amount that we'll receive in New Haven?
No, so what we're excited about is that there's also carryover. So we'll be able to carry the funds into the next fiscal year.
Excellent.
No matching funds.
Excellent, thank you. And then just the last thing, sorry, so the summary states that this is Connecticut-wide. Is this a regional project? Is there some sort of pinpoint in New Haven? How does that work?
The grant specifically, the $1.2 million is specific for New Haven, but we are going to be sharing resources in regards to time and expertise regionally. So we will just do planning in sharing of resources, not financial resources, but more of best practices and things of that nature.
And just one more question, Mr. Chair. Are there other specific partner towns that are there other towns specifically that we're partnering with? What does that team look like? Yeah, so the regional, the existing structure for regional planning exists of Region 2 is local health departments and their emergency preparedness coordinators. And then ESF 8, which is an essential function 8, is
consists of all the different healthcare sectors, including emergency management directors, AMR, and different healthcare entities like hospitals, long-term care facilities, community health centers, et cetera, representatives on a regional basis. So the Greater New Haven region specifically. And those partners will meet, they meet every month, or now through Zoom. And so we participate, and we will have this new staff also participate with mass vaccination planning.
And so essentially, so this funding extends beyond New Haven to New Haven County.
The funding is specifically just for New Haven Health Department. We will just participate with regional planning meetings. Every single health department in the state has received funding depending on their per capita size.
Okay.
So we don't have to share financial resources. We just have to participate in existing regional planning meetings.
Thank you, Mr. Chair.
My apologies, I skipped Alder Winter.
Thank you, Mr. Chair. Could you tell us anything you know or are hearing about the rollout of a vaccine, and what is the health department's role in something which I assume the ultimate goal is to get everyone vaccinated, but what is our role? Who would come first? What would it look like if there's any information available at this point?
So yeah, no, absolutely. That's actually a good question. So there's a lot of preliminary information because we're still waiting for official FDA approval. So what they have us doing, as with in the past in other emergency preparedness, the role of the health department would be to provide mass vaccination to the targeted population that we are designated to do. So the state will determine exactly which population will be our priority, and then they will give vaccines to other sectors to reach out to other target populations. Right now, they are doing it in different tiers. What they have asked us to do is a critical workforce assessment and evaluation. So we've completed that survey. We also had to complete a survey of critical workforce in regards to being able to scale up a mass vaccination clinic. However, the specific audience has not been necessarily finalized, although they did tell us that we will be part of the initial phase and will be limited with the number of vaccines that we will be getting because they're still unsure the amount they're going to be getting designated to Connecticut. So what we'll do, and I think that you raised a really good question, is once we get the full plan in place, we can certainly offer a webinar. We can come in and do a workshop to this committee and inform you of what's happening so that you can all either participate and volunteer, because we're going to need volunteers as well, and at least be able to get a better layout of what the plan is. But right now it's more surveys, making sure that we at least have critical workforce identified and things of that nature. So it's very preliminary right now.
What would you need volunteers to do?
Registration, traffic control, things of that nature. So we can certainly have lay volunteers to assist, and we already are planning on doing contact lists as much as possible, set up, breakdown, and then we will scale up our nurses to be able to give out the vaccines. Actually, my nurse director is on the line. Hi, Jen. Although I told her to enjoy her evening off.
So if I understood you correctly, Connecticut would have a limited number of vaccines, and then the health department would be tasked with making sure that individuals in whatever the target segment the state defines is get those vaccines as soon as they can. And we need volunteers to help that process along with the things that are non-medical.
Exactly. And so we will, what we did is an assessment of how many people, if we needed to scale up for citywide, if we're scaling up for a smaller size. So we've been basically doing more of assessments and surveys. And so that's exactly what we would be doing. And of course, it's all preliminary. So once we find out and get definitive responses, tasks from the state, then we'll be able to finalize our plan. So right now we are working with the region in case the rollout is regional, and we're also working locally with our local committee in the event that it's a local response. So we're preparing for both, because right now we haven't been given a definitive response.
Well, I think the suggestion for a workshop, once you have more information, is a great one. Thanks so much,
Absolutely.
Director Bond. Thank you, Mr. Chair.
No, thank you.
Alder Sabin.
Thank you, Mr. Chair. I have no questions at this time.
I do have a question, actually, and I'm not sure if you're able to answer it or not. So if you can't answer it, that's fine. I know I'm not the only one that may have concerns about how this vaccine conversation has been happening nationally, and its rollout, and the CDC changing the benchmarks, and the FDA making controversial decisions on certain items. Does the health department have any way of ensuring members of the public that what is likely to come out is safe, and not a result of just political expediency?
No, I agree. The Department of Public Health and both the local health directors meet on a weekly basis, and we discuss vaccine updates, as well as other updates, to discuss and ensure that whatever we are going to implement is not, all due respect, political has its place, but it shouldn't be harming individuals' lives. And so what the Department of Public Health will do is make sure that they're making a decision that's going to provide the most protective factor and facts to the public, as transparent as possible. And so just like with any vaccines that come out, there will be a vaccine information statement. The side effect, everything will be clear and also in multiple languages so that people know what type of vaccine that they're going to receive.
Okay, thank you so much. I know that's the question on the forefront of a lot of people's minds these days.
No, absolutely. We talk about it a lot.
All right. So that's everyone. Okay, so we will, are there any members of the public wishing to testify on this item? And I'm not sure I would know that. Are there any other members of the public wishing to testify on this item? Are there any other members of the public wishing to testify on this item? Seeing none, we will move on to item 2.
So do you want me to introduce myself again?
No. Oh, well, I guess you should. Never mind.
Okay.
Yep.
Marixa Bond, Director of Health for the City of New Haven, 784 Quinnipiac Avenue. This grant is the Connecticut Health Foundation grant. It's a 6-month grant specifically to address the flu season. The grant aims to hire 6 part-time community health workers to develop a social marketing campaign, as well as assist with COVID-19 testing sites to increase flu vaccine sites. The funding source that we're anticipating to get is $217,000. The grant period, the Connecticut Health Foundation are going to notify us by September 30th if we are going to be invited to submit a full proposal that which then will give us another 30 days to then execute a contract. What they aim to provide support to is that they are anticipating an increase of flu season in different areas, and want to ensure that there are community health outreach workers supporting and being able to be on the grounds and being able to promote the importance of getting a flu vaccine. And so they will provide, number one, education to residents on how to prevent the transmission of COVID-19, as well as seasonal influenza. They will assist with contact tracing in the event that we have a surge, provide information on how and where they can receive COVID-19 testing throughout the city, as well as flu shots, and then assess an individual's or family member's basic needs and their ability to self-isolate, or if a member of a household has tested positive or a presumptive positive case for COVID-19, and refer them to the Community Services Administration office, and identify local community resources to help address their specific needs. We will also, those community health outreach workers will also provide non-clinical support at the community-based clinics and helping with registration, setup, and breakdowns as well. So this is, again, a short-term grant that the Connecticut Health Foundation has invited us to consider, and will be notifying us September 30th whether a full proposal will be requested from us.
Great. Are there any questions? Well, I guess I'll just name Vice Chair. Do you have any questions?
Thank you, Mr. Chair. I have no questions at this time. Thank you.
Alder Winter.
Thank you, Mr. Chair. No questions at this time.
Alder Kupo.
Thank you, Mr. Chair. I have no questions at this time.
Alder Sabin.
Thank you, Mr. Chair. No questions at this time.
Okay. Thank you very much for your testimony. Are there any other members of the public wishing to testify on this item? Are there any other members of the public wishing to testify on this item? Are there any other members of the public wishing to testify on this item? Seeing none, the chair will entertain a motion to close the public portion of this hearing.
So moved.
Here, it moves. Do I have a second?
Second.
Second.
All right, I was afraid you all wanted to keep the public hearing going. No, all right.
Thank you, everyone.
Bye.
Stay
Bye-bye.
safe.
Thank you.
All right. So the following portion of this meeting is for committee action only. Just a note to folks, when there's doing committee action only, it's I'm doing this as the chair, making some strong suggestions that we read and file items. So that's what that means most times, in particular for me. But I do want to give folks an opportunity to make a comment on any of the committee action items before I entertain a motion to read and file them. Alder Sabin.
Thank you, Mr. Chair. I submitted this item back in May when things were a little bit more uncertain with the pandemic, and I was hoping to hear from city staff, and I feel like we've gotten a lot of communication with city staff over the last few months, and we are in a very good spot. So I think it is appropriate to read and file item 3.
And I obviously on item 0273, we had a hearing. It was a pretty comprehensive one concerning the workshop. I do understand that there was follow-up with Michael Piscatelli and a few other folks. I would encourage you all to continue that follow-up. And we'll likely have a moment for an update anyway, because actually statewide, I've seen some universities even contemplating sending students home. So I'm just curious to know where our local universities stand on that subject. So we will likely have another workshop on it. Okay, at this time, the chair will entertain a motion to read and file both of these items.
I move to read and file items 3 and 4.
Hearing it moved, do I hear a second?
Second.
Hearing it moved in second, all in favor, say aye.
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 Opposed? Abstentions. The items pass for read and file. So it'll go to the full board for a read and file recommendation. Okay, and now to do the work of the passage of these grants, assuming everyone agrees. Anyone would like to make any action?
Mr.
Yep.
Chair, I move items 1 and 2.
Second.
Hearing items 1 and 2 moved and seconded. Discussion.
Thank you, Mr. Chair. I would, may I?
Sure. Yes, you may.
Thank you, Mr. Chair. I think it's important for us to move these items. I definitely hear the chair's concerns about the safety of whatever vaccine is rolled out. It's good to know that both the state and our local authorities are share those concerns and are monitoring the rollout to make sure that folks here at least are not harmed by any decisions made out of concerns for political expediency rather than public health. And hopefully the vaccine that is ultimately released is one that is beneficial and one that our health department has confidence in. And the planning that they're doing right now and that this grant will assist them in doing will help us to protect the target population, whatever the state determines it'll be, and that we as alders and the public can assist them in that through getting folks to volunteer for the non-medical tasks that they started to sketch out. So I think it's really important that that we give them those resources and hopefully they are able to deliver on something that will protect the public here in New Haven. Thank you, Mr. Chair.
Anyone else? Yes, to Alder Winter's point, absolutely. I underscore everything you said. And I'd actually like to add one more piece of emphasis that we need to remember as alders. We represent communities that are extremely diverse. And in particular, there's a strong history in communities of color around kind of being, for lack of a better term, guinea pigs to these types of vaccines and so on. So as we begin to work along with the health department and the State Department of Health in ensuring that the vaccine is indeed safe and tested and proven, that we are sensitive to that history and that concern. We as alders, we actually will end up playing a big role in ensuring that disaffected communities and communities of color don't feel targeted, as history, unfortunately, has determined itself. And just for some further education for members on the Health and Human Services Committee, I'd like to plug a book called Medical Apartheid. I'm going to make that required reading for this committee if you have not read it. That book is extremely informative as to the development, as to why we actually renamed this committee the Health and Human Services Committee, and the history in that chain that we follow in terms of decision making. It's called Medical Apartheid. Feel free to look at that. Okay, so anyone else? Seeing that, okay, so we moved and seconded. We had discussion. All in favor?
Aye.
Aye.
Any opposed? Any abstentions? The item passes as a favorable recommendation to the full Board of Alders. Does anyone have anything to share or to add? Okay, The chair will now entertain a motion to adjourn.
Mr. Chair,
Yes.
I make the motion to adjourn.
Are we sure? I don't know. It seems like folks want to stay. I don't.
I can.
Hearing it moved in second. All in favor?
Aye.
Aye.
Opposed? Abstention? Have a great night. Please stay safe.
You too.
You too. Have a great night. Stay
Good
safe.
night.
Bye.
Bye-bye, y'all.
Testing my mic. Can anybody hear me? No?
Yes.
You can hear me, Ron? You can hear me? Now, that was a well-chaired meeting.